Hello, everyone. I'm Nat Kamada. Welcome you today to the second day of the Canadian Global Oncology Workshop for 2021. On behalf of the Canadian Global Oncology Network, we would like to welcome you to the second day. It's hosted by Queen's University. We have a full day for you, and I hope you will enjoy it. We will be having the first session on racism and coloniality and global cancer control, followed by universal health coverage. There will be networking session with discussions, and we will be also in the afternoon talking about digital health and cervical cancer control. With that, I will let's start the day.
Good morning, good afternoon.
I can hear you.
Can you hear me okay?
Mm-hmm.
All right. So thanks, Nazik. Good morning, good afternoon, and good evening to everyone joining today. Welcome to this session. As Nazik mentioned, this is the session on racism and coloniality in global cancer control. My name is Paneet Bains, and I'll be moderating this morning's session. I'm fortunate to be able to gather on traditional, ancestral, and unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. So we start this session off with a keynote address by Dr. Sumegha Asthana, followed by a panel discussion with equally amazing leaders and Q&A from the audience. I'll try to keep us on time within the 1 hour time limit. So without further ado, it is my pleasure to introduce Dr. Sumegha Asthana. She is a physician and health policy and systems researcher based in India. Her doctoral work is a policy analysis of the role of global actors in strengthening health systems in India. She works at the intersection of global health governance, influence of development aid on national health policies, political determinants of health, gender, and mainstreaming of alternative systems of medicine in public health. She works as an independent public health consultant and holds honorary positions at the Institute for Public Health in Bengaluru and Queen Mary University, London. She is also the country lead and co-founder of the India chapter of Women in Global Health. Dr. Asthana, over to you.
Thank you for your kind words and for inviting me to today's session. Good morning, everyone. It's truly an honor to deliver a keynote to this important session today. I would like to open my address by saying that I am not an oncologist. I'm not qualified, trained in quote unquote modern medicine. I know what you all must be thinking, but I also double checked with the organizers, that if they've sent me an invite by mistake. When I got the invite, I was sure that the topic mentioned on global cancer control is not my area of work. But I was also about connecting with the audience on the panel, with those who are driving a movement, a revolutionary movement I want to be a part of. So I just grabbed the opportunity. The most inspiring thing about decolonizing anti-racism movement for me is that it's driven by the students and the practitioners of global health institutions, especially in the so-called global north, in the high-income countries, in the developed nations. Though this is inspiring for me, but few others, as they say, the colonizers asking for decolonizing the world is no less than a joke. And I think it's quite fair to receive that criticism. And it is this criticism that I want us all to be prepared for. I want us to be prepared by embracing the us in the moment and not focusing on the you, the them, and the me. I'll talk about this a bit later, but perhaps I'll start with sharing my understanding of the significant words that we're dealing with today, the terms that we're dealing with today on the panel: racism, coloniality, decoloniality, colonization, and expanding the global cancer control to global health. Coloniality and racism in global health, the ways we can identify it around us, and the ways we can try and emerge out of it wiser and stronger and more equal. Now, for this, I'll not quote the extremely rich literature from our amazing scholars in this area, but I would just like to draw your attention to the central idea concerning these words, these concepts, these terms. And that is the idea of equality, of justice. Global health, as we all know today, as is defined, is the health for all people, of all people around the world. And many argue that there's been a shift in the 21st century with the coming of the global health partnerships, with the landscape changing, the shift from international to global health, the international health, which was more concerned with the health of specific nations, the international relations between nations, the international cooperation, to today's global health, which is concerned with the health of all the people around the world. But I don't think any shift actually happened. Now, those of us who've read the text from the international sanitary conferences of the 1800s, we've seen the then prominent diseases being called as Asiatic diseases, diseases originating from the filth of the Asian countries, to today seeing COVID being labeled as the Chinese virus and the travel bans being the today's developments around the discriminations and the name calling for the South African context. Now, then also, I feel the health, the trade, and the economic interest of the traders in the North was supreme. Today, again, we see that their health, their economic interest are supreme. The health of the poor, underdeveloped, privileged, marginalized, vulnerable was then protected just so they don't spread their diseases to the rich, developed, and privileged. And then also the claims were made of charity and cooperation and health for all. And we're seeing the same today with COVID. Now, sometimes I just wonder why. Do you also wonder why? Why? Why things have not changed all these years? I feel it's because this is the only way the project of coloniality works. It's the only way it functions. It functions on creating, on exploiting, on benefiting from the inequalities. It works through exploiting the weaker ones for the benefits of the powerful. And if you look around, we'll see our health systems have developed in the same way, at least in the colonies. But in all of this, what is most unfortunate, most disappointing to me, is that even those who were colonized, even the colonies which later got independent, carried forward this legacy. And they said they did the same to their marginalized, to their people who were living at the margins and who were the most vulnerable. Now, the discrimination, the power hierarchies, they're not seen not only in terms of who gets the best medical education, who gets the best medical treatment, but it's also very much seen in terms of who gets to eat better food, who gets to snatch the rights of lands from the indigenous people in the name of quote unquote development. Isn't it? I mean, don't you all find it an irony that we really want to develop those indigenous, those tribal, those remote communities who have like zero carbon credits and bank debts? We want to develop them. We who live on processed food want to develop those who eat the most organic, straight from the farm to the plate food that we now fancy. We who don't even know our neighbors want to develop and strengthen their communities. It just amazes me why. Why do we ignore the knowledge of the communities at the ground, the indigenous people, the tribal people, the same people who could for centuries heal and protect the health of their people without any Western medical interventions, without any outside medical interventions, but through their own systems. Why do we ignore their knowledge about their bodies, about their health? And not just ignore, but we also superimpose the knowledge imported from outside, from abroad. And we tell them about their bodies, their needs, their health needs. Being trained as a physician, though in alternate medicine, I today feel, why didn't we ever question the knowledge we consumed? Why didn't we today even question the knowledge we produce? Why haven't we been trained to have a critical take on the textbooks we read? Have we ever bothered to look up the identities of the authors we read? Have we bothered to look where they come from? What are their realities? Have you ever looked up the demographic data of the vaccines trials, of the drug trials that we blindly follow and believe? How many of us have looked up the calculations and the assumptions used for DALIs, for the most sacrosanct formula on which we base our policies and priorities? Have we questioned the value systems in those calculations, which do not value the elderly population because they're not economically productive? Have you ever bothered to go and see on what assumptions are these matrices today are based on? We just blindly follow them because we feel that that knowledge is coming from someone who's more technologically advanced, more technically advanced, more supreme, maybe better trained than us. Have we? If not, then I think it's time to identify these imbalances, these inequalities, these hierarchies. And if we are fortunate to have identified them, I think it's time to take action. It's time to take action against the dominance of certain knowledge systems over others. Take action against certain education institutions being prioritized over others, certain race and ethnicities prioritized over others, certain gender prioritized over others. It's time to question and change the fact that 92% of the CEOs and board chairs of global health organizations have been educated in high-income countries. And this includes 60% of the nations who are from the LMICs. It's time to change the fact that only 5% of the women global health leaders come from LMICs. There's a lot that needs to be changed. Action is needed at all levels. At an individual level, we have to be more reflexive, to acknowledge and use our position. Use our privilege in the society wisely. Lean out when needed and lift up and participate when needed. At the community level, we need to organize ourselves. We need to take ownership of our issues. We also need to ask for our rights. At an organizational, local, national, even at the global level, we need to ensure fairness and equity in composition, in decision making. We need to fix the accountability at these levels and also ensure transparency. It's time to reform, to question the colonial ways of doing research, the parachute researchers, the way we publish, the way we do research, the way we understand evidence. We need to question on why social sciences is not considered sciences. And to give supremacy to science, we have to even attach prefixes like pure science, as if the other science is not science. Why is the anecdotal evidence not treated as evidence? Why the tacit knowledge is not treated as knowledge? Why are we obsessed with the meta-analysis and systematic analysis? We have to change the way we practice medicine. We implement policies to reform and be more critical of the ways we teach and we read and we learn, who we learn from, what we read. who we read from. But I also know it's tough. It's tough, and it's even more tough. It's more difficult today to raise your voice against the inequalities, against those who are in power. With the growing popularity of the populist governments, nationalism, the working conditions in this gig economy with everyone working on the contractual arrangements and having no agency at all, the economic structures, the ever-shrinking resources. Yes, it is tough. It's even tough for those of us or those who are probably in the audience today, if they're considered as the one who actually colonized the world. Those whose intent is always questioned, those whose actions are always questioned, their charity and their benevolence is always questioned. But isn't this a small challenge in comparison to the challenge of those who are sitting at the margins, who are actually facing the harms, bigger harms, facing the inequalities, not getting their due shares? I feel it's nothing if we could collectively reduce the inequalities even by a bit. I also feel that the students of global health, the practitioners of global health, be in whatever domain, they have the power, they have the strength. They are today aware, they recognize this, they have experienced this. And I feel that together, we will build a more equal and a just world. Thank you for listening. Thank you for inviting.